What will the national health insurance mean for medical aids?
Eventually, the medical aids will have to give way because we want one seamless system for everybody. I've told you, medical aid are fragmented healthcare financing system, not for everybody in the population, but for a selected few. And mostly, you have got to get a job first. If you don't have a job, you're out of it. Now, United Nations call this universal health coverage. Universal means everybody. So we want one united pooling of funds for everybody.
What will it mean for, let's say, a South African that's covered by medical aid now and is happy with their cover? What's in it for them?
How many South Africans are happy with their cover and how many are not happy with any cover because they've got nothing? Who are we talking about here? Medical aids, 83 of them in South Africa, cover only 16% of the population. 84% of the population have got nothing to be happy about because they are not covered. So people must appreciate that we want to be a nation where equality and social justice and social solidarity is the order of the day.
What do you think is the biggest myth about the national health insurance?
They believe it's going to be more expensive than the present system because they believe we are just going to extrapolate it on the present system, which is very expensive already. And they say if this system is expensive for 16% of the population, what about for 100% of the population? And I've just emphasized that the present platform of health in both public and private will have to change. The second paragraph of NHI says this is a significant policy shift. It necessitates a massive reorganization of the healthcare system. So the myth is that people believe will implement NHI on the present public and private healthcare system as they are. That's a myth.
Currently, South Africans who are privately covered by medical aids enjoy tax benefits for that. What is likely to happen to those benefits under the national health insurance?
Firstly, the state subsidizes you to join a medical aid scheme. Secondly, they do that when you earn a very high salary. And thirdly, they give you tax credits, reward you for joining a medical aid scheme. Surely this can't be fair. And that is being done to only 16% of the population, while 84% is sitting out there and watching. It can't be acceptable. And so we are targeting the tax credit, and it's not me only. If you go and read the speech of the Minister of Finance, not of Health, Finance, during the budget speech in February this year, he said we are going to establish an NHI fund to help certain sectors of the population. Part of the source of that NHI fund to help them will have to come from the tax credit, meaning what? You are taking money that is being sent to people who are already rich to help those who are poor. And that is called social solidarity.
And finally, is there anything else that you feel the public needs to know or better understand about the national health insurance?
The whole concept of providing health care for all, for everybody, is not an invention of the Minister of Health or of the governing party now. It's in the Constitution. It's Section 27 of the Constitution. It says health care is a right, and the government must do everything in their power to make sure that this right is realized. So it's a constitutional obligation